Hello everyone. Today we are going to learn about rickets. Rickets, it is a important disease that is a metabolic disease of a bone, which is a very important topic in orthopaedics for university exam as well as for a next exam. So here rickets are defined as a insufficient mineralization of a osteoid leads to rickets. Osteoid that which is a bone matrix. Okay, so it's a disorder of a children occurring before facial growth. Etiology of rickets are divided into four parts: vitamin D deficiency disorder, calcium deficiency disorder, phosphorus deficiency disorder, and renal losses. Calcium deficiency and phosphorus calcium deficiency and phosphorus deficiency, low intake, which is due to a malnutrition and dietary intake. Rickets of prematurity is an important term. Here we can define this term as by in a second and third trimester of a pregnancy, the 80 to 85 mineralization of a fetus is transformed. But if the fetus is premature at the time of third trimester, the mineralization doesn't occur. So we can use the term rickets of prematurity. The bone will be a weaker and the child will get a rickets. Okay, now further we learn the clinical manifestation of a rickets. So here the first clinical manifestation, that is the earliest sign of clinical manifestation, is seen in a skull. So craniatabs, which is defined as a softening of a skull. This is you can understand by if you can use your thumb on a patient that is on a parietal and occipital lobe, occipital part of a bone, and that if the depression on a skull and it's come back, that is called a ping pong skull. That is a very important and earliest manifest clinical sign of a rickets. Another sign you can see a frontal bossing, that is a frontal bossing, and fontanelle delayed closure, anterior fontanelle, that you can see the which is not closer earlier. It's also an important sign. Now second we see on the chest, that is a rhachiatic rosary. These are the penless costochondral prominence. Why we call that a costochondral prominence? In earlier, if you back in earlier classes or basics of orthopedics, you learn about four zones: zone 1, zone 2, zone 3, zone 4. That is a zone by reserve cell proliferation, hypertrophy, and mineralization, and fifth zone is a calcification zone. Okay, so if osteoid not found, if cells of matrix in a further zone, reserve cell proliferation, hyper, if mineralization is not take place, the osteoid matrix will enlarge here in this condition or accumulate at zone 4 and not further reach to zone 5th. It will migrate, not migrate. So deposition in zone 4 show enlargement and around costochondral junction. So it is a very important sign, that is rhachiatic rosary. Another term is a sclerotic rosary, which is seen in a osteoporosis. Okay, so here you can see the pectus craniatum, which is a prominence of a sternum or Harrison groove, which is a depression along the attachment of a diaphragm at the subcostal margin. Okay, so here we further, it is a third sign is a clinical manifestation is a shortening, that is a short stature, which is seen in long bones. That is a very important sign which is physically seen in long bones at a diaphyseal area. We can see a bowing of knees, and in long bones at a metaphyseal area is splaying and fraying, that is a irregular splaying, and that is a widening of a bone. Here you can see in a knee area that is a three term is used: genu varum, genu vulgum, wide wind swept of legs, which is a very important term. So here we can simplify this as by showing this diagram. You can easily learn this at the hip, knee, and the ankle area. This is a normal structure of a bone. Here you can see the at the midline. From you can midline the here the knee can widen away from the midline, and in the ankle area there is a in a midline away from the midline. Okay, so that is called a genu varus bonis. And in the here in the midline you can see the knees are in near the, not away from this. So we are going to use the term genu vulgus, that is a knock knee condition. In other, coxa for a hip, genu for knee, or cubitus for elbow. These are terms for use for a joint. That is a hip for a coxa bara, which is the important sign for a rickets. Normal angle between the neck and the shaft of the femur is a 125 to 130 degree, like that. Okay, so okay, that is a, and this is a condition of a coxa vara. It is a condition of coxa valga, which is a 135 degree greater than angle, not commonly seen in rickets. So commonly seen in rickets, the condition is a coxa vara. Another clinical manifestation is a muscular flaccidity, weakness, tetany, and protuberance of a abdomen. That is also seen in a patient of a rickets. Okay, so how to evaluate the patient of a rickets and diagnose the patient? So here are two methods, like serum calcium phosphate vitamin D, which is a decrease in a patient of a rickets, and serum alkaline phosphate, which is raised in a patient of a rickets. Okay, treatment. Now we how we going to treat the patient of a how we are going to treat the patient of a rickets. So supplement, like we can give the calcium and vitamin D supplement, monitoring of response, which is a very important thing, like radiological monitoring. And in radiological monitoring we see a appearance of a white line stromal on metaphysis on a x-rays, and can be seen on a within 1 to 1.5 months. Okay, in a metabolic assessment, which is a very important sign of a treatment, done by level of alkaline phosphatate. Initially the level of alkaline phosphatate will be high when we start supplementing minerals. The bone start getting formed or normal. Gradually then it is a decline. A level of alkaline phosphate and bone is healthy, so we can say the alkaline phosphate is a normal. This will occur in a 1 to 1.5 and 2 years come back to normal. This is the important sign which can define the bone become a healthy in a rickets patient. Another that is the doses of a vitamin D given is a medical treatment and orthopaedic treatment. The vitamin D, like 6 lakh units of oral dose for a rapid healing of a rickets patient. If a line of sclerosis is not seen on X-ray, then further 3 to 4 weeks of therapy we can repeat the dose. Now, if response is seen on a vitamin D that therapy, the dose is decreased, that is a 400 international unit per day. If no response is seen, then refractory ricket or diagnosis will be taken. In a further, we can see the orthopaedic treatment, that is a conservative method and operative method. Conservative method, the mild deformities are treat, like correct, which spontaneously correct, or mermaid splint used by the surgeons, and orthopedic shoes, which is a very helpful for a rickets patient. Now further we can see the operative method, that is further classify in a moderate or severe patient of a rickets that will require a surgery. After 6 months of starting the medical treatment, the corrective osteomyelitis, depending on the nature of deformities, are performed. These are the surgeries which are used by a surgeon for on a patient of their deformity. So guys, please like, comment and subscribe my channel of for further videos you can update to here. In next video we are going to discuss about osteomalacia, which is also an important topic for university exam. Thank you.